Thank you for watching my video. My name is Gazania, licensed acupuncturist and herbalist with Naturally Gazania Acupuncture and Wellness Center. Before we continue, please subscribe to my channel and like the video. So today I will be talking about tongue diagnosis. So you would wonder, when you see an acupuncturist, they ask you to stick out your tongue and they look at your tongue and analyze it. So today I would like to go over some things that we look for in your tongue and why we look at your tongue, because many people come and visit me, many patients, and they ask, well, what are you looking for? Why are you looking at my tongue? How does it tell you about my health? And so today I'm going to break some of those things down. So by looking at the tongue, acupuncturists can get an idea of the patient's health. So when we look at your tongue, we ask you to stick it out. We're getting a general idea of your health. And so I want to help you to understand what we're looking for when we look at your tongue. So I want to explain to you the map of the tongue and what we're looking for. So if you stick your tongue out, right, the tip of the tongue represents the heart area. And then right behind it is the lung area. So we're looking at that. Right behind the tip is the lung area. And on the sides of your tongue is liver and gallbladder. That's what we're looking for, liver and gallbladder. And then right in the middle of your tongue is the stomach and spleen, which is like your digestion. Looking at your digestion, right in the middle. And then if you look further back in your tongue, that's the kidneys, the urinary bladder, and intestines. So that's a map of the organs of the tongue. And I'm going to place a picture of it. So, all right, now I'm going to talk about some of the qualities that we look for in the tongue, like the color, the form, and the coating, things like that. So when we ask you to stick out your tongue as a licensed acupuncturist, we are examining and looking at the color of your tongue. Just a general color. This tells us a lot about what's going on inside of your body. So healthy person will have a normal pink color. So some colors that we will see in patients' tongue may be a pale color. It's a really pale pink color, which really mean like they may be fatigued, they have a blood deficiency, as we would say. Also, there may be a color of red, or maybe deep red or purple. So some of these signs would be, maybe if they're purple, they have some like blood stasis, they may have pain, things not moving around like they should. Or if it's really deep red, that means they may have like heat signs. So these are certain things that we look at when we look at the tongue, the color. So that's one thing. Color is very important. Now I'm going to talk about some of the forms of the tongues that we look at and what we look for. So next, when we're examining the tongue, we look at some of the forms. So what I mean by form, I mean if you look at someone's tongue, we'll see if it's thin. If it's a thin tongue, if it's a thick tongue, if it's a swollen tongue, maybe it may have teeth marks on the side. That tells us that maybe they're not moving fluid properly in the body. If they may have a crack in the middle of their tongue, this means that their digestion, maybe they're not drinking enough water, or maybe they have a lot of heat in their digestion, inflammation. So looking at the form really tells us a lot. Or also maybe sometimes people can stick out their tongue and the tongue is deviated or it's quivering. So they may have like what we call wind stroke, or they may be possibly just had a stroke, and so that's why it's really quivering or deviating to the side. So these are some things that we look at, and it tells us what's going on the body. Like I said, if it's thick, if it's thin, if it's swollen, if it's deviated, if it's rigid. These are signs that tells us what's going on in the body so that we can help our patients restore their health. So then I kind of mentioned some of it earlier, but there's a quality of the tongue. So it could be thick or thin, moist or dry, or sticky or peel. So sometimes people will have the sticky white, like cottage cheese type coating on their tongue that they can peel off. And usually this could mean like, it's more of like a dampness, or like I eat a lot of like fried foods, ice cream, so the digestion is like not too great, right? So they have this white cheesy stuff and they can scrape off. So this tells us a lot about the digestion, right? It tells us a lot about what they're eating, so we can make recommendations as far as what they should change, like eat less fried foods, eat less dairy foods and stuff like that. And then also, like I mentioned, if it's moist or dry. So if it's dry, then it's like maybe they need to drink more water, or maybe something going on in their body where there's too much heat and it's drying up. So we need to do things as far as acupuncture and herbs to help them to nourish their yin, as we say, nourish the fluids in the body. So again, yeah, that tells us a lot about their health. So now I'm going to talk about their coating color that we look for. So like I mentioned, we look at the color of the tongue. So if some patients have, different colors of coats on their tongue. It could be a white coat, it could be a yellow coat, it can be a gray coat, it can be a black coat. So people have, it could be like an orangey coat. You look at the different coats of the tongue because it tells us different things. That's why we really suggest you not to brush your tongue before you come see us, because that coat tells us what's going on. We do ask you, if we see a yellow coat or an orange coat, like did you drink coffee or did you just eat some turmeric and things like that. But in general, just come as you are. We want to see your coat because your coat tells us what's going on with your digestion, again, what's going on in your body. And these are signs that help us to make a proper Chinese medicine diagnosis so that we can help you. So I hope that this video helped you to understand why we look at the tongue as acupuncturists. So I know sometimes some patients feel vulnerable. They're like, oh, you want to look at my tongue? Like, that's kind of private. But it really helps us in assessing what's going on in your body, and it helps us to use the proper herbs and acupuncture points, and also giving you a good recommendation so that you can restore your health, right? Get back to your health. So that's our ultimate goal, to become a partner with you, to help you heal and help you feel better. So again, thank you for watching the video. Subscribe to my channel. I will be posting a lot of informative information. Like the video, and if you found it very helpful or you want to share this information with others, please share my video. Again, my name is Gazania. I am a licensed acupuncturist and herbalist with Naturally Gazania Acupuncture and Wellness Center, and I hope you guys have a great day. And now that you know a little bit more about tongue diagnosis, when you wake up in the morning, stick out your tongue and look in the mirror. What do you see? Hope you guys have a great one.